Welcome to my channel at Veteriner Diary. In this video, we will share about hyperthyroidism in cats. Hyperthyroidism is a common endocrine disorder in cats, particularly in older felines. It occurs when the thyroid gland produces excessive amounts of thyroid hormones, thyroxine, leading to increased metabolism and a range of symptoms. Symptoms: 1. Increased appetite. Despite eating more, cats may lose weight. 2. Weight loss. Unexplained weight loss is a hallmark sign. 3. Increased activity. Cats may be more restless or hyperactive. 4. Vomiting and diarrhea. Gastrointestinal issues can arise. 5. Increased thirst and urination. Cats may drink more water and urinate more frequently. 6. Poor coat condition. The fur may become unkempt or sparse. 7. Behavioral changes. Some cats may become more irritable or vocal. Diagnosis: veterinarians typically diagnose hyperthyroidism through a combination of physical examinations, blood tests to measure thyroid hormone levels, and sometimes imaging studies. Treatment options: 1. Medications. Antithyroid medications can help manage hormone levels. 2. Dietary changes. Prescription diets low in iodine can help control the condition. 3. Radioactive iodine therapy. This is a definitive treatment that destroys overactive thyroid tissue. 4. Surgery. In some cases, surgical removal of the thyroid gland may be necessary. Management: regular monitoring and follow-up visits with a veterinarian are essential to manage the condition effectively. With proper treatment, cats with hyperthyroidism can lead healthy, active lives. Thank you for watching. We hope this video is useful.